Well, February is Heart Month, and here in the U.S., heart disease is the leading cause of deaths. According to the CDC, in 2022, 1 in every 5 deaths was caused by heart disease. But there are ways that you can be proactive. So joining us today are Dr. Josh Todd, a cardiologist with Covenant Health, and Caleb Gross, and you are 9 years old, is that
Yes.
right? Thank you both for being here. Let's first start, of course, the most important thing is prevention. So tell us what we need to know about that.
Yeah, absolutely. Knowing your blood pressure numbers is very important. We call hypertension the silent killer, and so not having the ability to know that your blood pressure is high and left untreated will cause heart damage, cause early risk of stroke, and cause kidney damage. So it's very important that patients know what their numbers are early so that we can prevent future heart attacks.
And you have to understand those numbers too, right?
Correct.
Sometimes I hear numbers and go, wait, is that good? Is that
Yeah,
bad?
and
So
we've changed them over the years. We're lowering our thresholds now. So now that anything over 120 as your top number and anything above 80 as your bottom number is considered hypertension now.
And you brought this with you. This is something you can get, you can test yourself or go to a doctor's office. Sometimes even, walk-in places have them now.
Correct. And the blood pressure cuffs are much easier. The big thing is knowing how to check your blood pressure. Again, we don't want to be within 30 minutes of exercise or stressful events. You want to be nice and relaxed and calm. Wait about 5 minutes in between blood pressure readings. When to check it's a little more of a debatable topic. And I would say just as long as we're checking it consistently every time.
And of course, if something does go wrong, we need to know what to do in times of an emergency. And I think Caleb is going to help us a little bit with that as well, because children as young as 9 years old can start to learn the proper method for CPR. So can you walk us through that, and Caleb will help us?
Yeah, absolutely. The CPR by patients' family members, other people around these patients that do have cardiac arrest saves brain, and that's the most important thing I can say at an out-of-hospital arrest. It's not what we do in the hospital. It's can you get on the chest quickly, and can we do hands-only CPR now, and do it effectively. So Caleb, I don't know if you want to demonstrate.
Yes.
Yeah, how do we do it? Yeah.
Okay.
So you push on the center, and you just start going.
And do you feel like you need to put a lot of pressure?
Yeah.
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 And you need to find the right spot to do it?
Yeah.
Okay. How did you learn how to do that?
My mom.
Your mom, of course.
Right.
And so if I were to do this and learn how to do this, because I haven't tried this in many, many years,
Right.
what do I need to know?
So again, that's where the American Heart Association is great. They will teach anybody, anywhere, hands-only CPR, but the rate at which we want to do chest
Yes.
compressions, about 100 to 120 beats a minute. There's lots of songs out there. We used to use Staying Alive. Now I saw something recently about a Kendrick Lamar song using that as a beat. But again, compressions are key. We don't have to worry about doing mouth-to-mouth or breathing
Yes.
for the patient. And then if we have an AED, realizing that can get blood pressure back and get your heart back in a rhythm so we can stop doing CPR a lot of times. So AED is a little more technical device that's going to read and shock the heart, and knowing how to use that as well. But again, American Heart Association is great in terms of teaching this, delivering AEDs to different companies, schools, all very important to learn how to use these devices.
And certainly I know we can go online and get more information and even sign up for classes, of course,
Absolutely.
to learn this as well. Thank you both so much for coming in today.